perimenopause and menopause, and the importance of a personalized treatment protocol that is unique and right and specific for you in your body. Hi, everyone. I'm Dr. Kristi Tompkins, and for over 15 years, I have been specializing in women's health, and specifically in the areas of perimenopause and menopause. And today I want to talk about something really important that has a lot to do with the individual treatment approach for addressing any perimenopause and menopausal symptoms. So just for the record, perimenopause is usually a few years leading up to menopause. It could be a few years to 10 years. Menopause is when you have not had a period for 12 months or longer and it's not coming back. You are done with your menstrual cycle. So for the purpose of this recording today, I'm going to focus mostly on perimenopause, although a lot of women who are perimenopausal still having a period and the women who are menopausal not having a period, sometimes those symptoms overlap. So when it comes to a woman's symptoms that she might be experiencing with regard to perimenopause, it's going to be individualized. And I say this a lot with when I'm on a podcast, my own podcast. I say this with my own clients that come to see me, is that no two women are alike, and your symptoms, what your best friend or your sister or your neighbor or your mother might have experienced with regard to perimenopause, menopause, that may not be likely is not what you're going to experience. So your symptoms are unique to you. If you even have any symptoms, most women do. With regard to perimenopause, because the reproductive sex steroid hormones are dropping, estrogen, progesterone, testosterone, cortisol can get out of balance, thyroid can get out of balance, things like insulin can get out of balance, and others that usually causes an assortment or a cascade of symptoms. And with regard to symptoms, those are going to be individualized for each woman, but the treatment approach that that particular woman needs is also going to be individualized as well. So I always say there's no such thing as a one size fits all, because a one size fits all doesn't really exist, because you can't give one woman one treatment protocol of recommendations and expect that another woman is going to respond in the same way. So when it comes to for example, let's say weight gain or difficulty with energy or brain fog or difficulty sleeping, usually what I do when a woman comes to see me is I spend a generous amount of time with her. My first appointment's usually about 90 minutes. The follow-up appointments are almost always an hour. And so with that generous amount of time, I get to really dive in, ask questions about her current symptoms, ask questions about her past medical history, past hormonal menstrual cycle history, potentially family member history. But usually I find that that is less relevant to what she is experiencing. And I definitely don't ask about what her best friend's going through or the neighbor across the street, because that's also irrelevant. When I get that list of symptoms, and those symptoms are not only going to vary from woman to woman, but also they're going to vary from the stage of perimenopause that she's in. So let's say she's 43, early 40s, compared to a woman who's 50 or 51, still having a period. Those symptoms are going to be different. They could even be different from year to year, but also from like season to season. And those symptoms can also vary based on what's going on in your life. Generally speaking, the more stress you have, the more emotional distress, psychological distress, physical stress, chemical stress, things like that, that will also influence your hormonal symptoms, specifically perimenopausal symptoms. So your symptoms are unique to you, and therefore the treatment protocol should reflect that. So whether it's weight gain, as I mentioned, difficulty with energy, with sleep, maybe having some night sweats, maybe difficulty with mood swings, changes in feeling a little bit more achy, like joint aches, muscle aches, difficulty concentrating, the treatment approach is going to reflect that. So with my female clients, I always do testing. I do a combination of blood testing, serum test, blood or serum, a complete blood chemistry analysis panel, a lipid panel. I do a hormone panel, not just the reproductive hormones, but the thyroid hormones, the adrenal hormones, the FSH, LH, the pituitary gland hormones that communicate with the ovaries, and a bunch of others as well. Because I really want to get that full body picture of what's happening with that woman. And I also like to do a Dutch test or a dried urine hormone test that looks at the sex steroid hormones and the corticosteroid adrenal hormones through saliva and with urine. And so that collectively, in combination with her symptoms, gives me a lot of information to go from or to evaluate to then give her a personalized treatment protocol that's going to be best for her. And again, that might be one treatment protocol at the beginning of, let's say, my 6-month program. There's going to be a specific protocol that might vary or differ from what she's going to have at the end of the 6 months. Or if she continues with me, or she decides she wants to come back a year later and get an update or a reevaluation of her health, that treatment protocol might also be different. So with regard to treatments, I won't get into specifics here today because, again, as I just have emphasized, it's really case by case based on that woman. With regard to supplements versus bioidentical hormones, I get this question a lot. Like, do I do supplements, herbal supplements, nutritional supplements, or do I use bioidentical hormones or hormone replacement therapy? It depends. It's really going to depend on what she needs, what's going to, what her symptoms are, the severity or complexity or the simplicity of her symptoms, and what she's going through. And a lot of women don't want to use hormones for various reasons. Some women do want to use them, but I want to caution that if you're on the wrong dose of bioidentical hormones, whether it's pellets or creams or oral micronized forms or troches or drops, that is going to be based on how your body responds. So sometimes the wrong dose or too much is going to give you symptoms of too much bioidentical hormones. And for some women, they're often worse than the actual symptoms of perimenopause and menopause. So with regard to hormone replacement therapy, you may not need them at all, or you may not need a very high dose, and you may not need them for very long of a period of time. So I sometimes I will pair that with nutritional supplements, definitely lifestyle practices and lifestyle recommendations, looking at the food you're eating, the quality of the nutrition you're getting, the type of exercise, whether it's muscle strengthening, aerobic conditioning, stretching, yoga, not just your exercise and your diet, but also your stress. How are you thinking? Not just things that are happening to you or happening for you in your life, but how are you responding to those things? What are you doing with regard to your mental strength and your mental power, your meditation, your mindfulness, breathing, doing things throughout the day, spiritual work, prayer work, anything that you can do to connect on a deeper level to your soul, to your spirituality, your divine connection, and whatever that looks for you. So it's really a whole person perspective, body, mind, and spirit when it comes to the symptoms you might be experiencing, but when it also comes to the treatment resolution or treatment symptom alleviation and symptom resolution with regard to addressing what's happening with your body. And so I think that's it for today. If you have any questions, please, as always, reach out, leave a comment below if you enjoyed this video. But just one more emphasis on making sure that you talk to somebody who can really give you that personalized, individualized approach to your symptoms. No size fits all, no one size fits all with regard to your perimenopausal symptoms, and it's really important that you get that guidance and that influence and recommendations that you need so that you can heal in the best way possible. Be sure to subscribe to this channel. I will be listing more videos with regard to perimenopause and menopause and some other women's health conditions as well. Take care.